Thank you.
I'll call upon the board now to give me agenda approval for our program this afternoon. Moved by Gary Kushak, thank you, and Tracy Bailey has support. Any announcement of conflict of interest on the agenda as presented to you today? I hear none. Okay, and we've got an update, I believe, from Dr. Nazatiri coming up.
So members of the Board of Health, Board Chair, Mr. McNamara, my colleagues, thank you for allowing me to speak today. I want to share a few comments and remarks. The burden of COVID-19 in these has been increasing in these past few weeks, and that's manifest by increasing number of cases around 300, increasing number of deaths around 675. The majority of the recent deaths are people who live in the community, meaning that these are people that, save for COVID, they probably would have many additional years of life to live. 40% of the long-term care facilities and retirement homes, approximately 40% in this health district, are currently in COVID outbreak. This is in the context of the hospital system being saturated. I was talking to the epidemiologist today and reviewing the data, and I think he had said to me that hospital utilization rates are greater than 100% at the current time. As all of you know, the ambulance service is in code black, which in some ways translates that they won't be able to pick up people who might need to be picked up. More subjectively, I spoke to a colleague of mine, of ours here in Windsor-Essex, who works in a 24 physician group, and his words were, "We're seeing a tsunami of respiratory disease." And he went on to say that some of the people are testing positive for peak COVID, some are not. Some may have the flu, some may have other respiratory diseases. This is in the context of overall COVID vaccination rates being low. The epidemiologist ran some data today, and only about 19% of people are really up to date on their vaccines for adults. So meaning this, 19% of people over the age of 18 have had their primary series plus a booster in the last 6 months. What does this all translate into? I think it translates into a potentially challenging fall as we have co-infection or potentially co-infection with flu and with COVID. Flu is a very is also an unpleasant illness, and it affects multiple organ systems. We have had deaths from the flu as well in previous years. The flu was in a quiescent period during the first part of the pandemic. In fact, for approximately the first 2 years, we didn't see any flu cases. In March of 2022, we started to see a recurrence of flu, and flu cases have continued all the way through. So what can we do about all of this? Obviously, we're in a challenging situation with the board and with the health unit. You know, the public health service is more than just about the care of individual patients. In fact, the care of individual patients is primarily the responsibility of doctors and hospitals and nurses. But the care of the community, the overall care of the population, is the public health service priority. So the first thing I would say is all the stuff we've been always saying, which is stay at home if you're sick. If you're sick, stay at home. If you're not up to date on your vaccines, get up to date on your vaccines. If you're indoors, wear a mask. If you can't remain consistently 2 meters away from somebody else outdoors, wear a mask. If you're eligible for antiviral medications, get the antiviral medications. But also, I think that we also have to think of how we live with COVID. And part of living with COVID, because COVID's not going away, but we can learn to live with it. And part of learning to live with COVID is, in fact, having a hospital system and a healthcare system that can manage the burden and the influx of diseases and cases. And substantively, access, quality of care, and patient satisfaction are three of the most important facets of the health system. And we have to work on all three of them. from my perspective, COVID has been a burden to the health system and a burden to the community, but it has also interrupted the care, delayed the care, and distorted the care of people who don't have COVID. And as important as COVID is, and it is important, there are other diseases that are also important: cancer, cardiovascular disease, stroke, diabetes, osteoarthritis, people needing total hip replacements, total knee replacements. All of those people also need the care of the health system. And as we move forward in learning to live with COVID, which really has to be the plan in my estimation, we have to think of a framework that we can provide care to all the people that need care in a timely manner. I always remain optimistic. Medicine is about remaining optimistic. There's lots that we can do to help people. Just in my lifetime, many things that we thought we couldn't get a handle on, we have. And I could just give one example. When I first graduated, HIV was a death sentence. Today, HIV is managed like a chronic illness. That's just in my lifetime. So I'm optimistic that if we apply the right amount of energies and the right focus, that we can get control of this situation and have a meaningful plan and a successful plan moving forward. Mr. McNamara, board chair, members of the board, thank you again for letting me share my remarks, and I'm happy to answer any questions.
All right, thank you very much, Dr. Nestor. Any questions to our medical officer of health? Don't see any hands up at this stage. And oh, Gary, go ahead.
Yeah, thanks, Chair. Good afternoon, everyone. Certainly trying times here. It seems to be a lot of people sick these days, as Dr. Nestor said. A potential date when flu shots will be available at pharmacists and doctors and at the health unit. Doctor, do we know that one yet?
Yeah, and you know, my colleague Christy primed me on this, and I somehow forgot to mention this. So thank you. Flu vaccine is available now. It's been distributed to about the 7,000 people who are living in long-term care and retirement homes. It's available at pharmacies. The health unit is focusing on vaccinating the highest risk population now. In November, we'll expand our focus a bit more. The fact of the matter, though, is that the vaccine is available now. People who are eligible for it should go out and get the vaccine. If I could just share some generic numbers, the health unit alone anticipates distributing 100,000 doses. Now that goes through channels like family physicians. But then there are other channels which the health unit is not involved in, like pharmacies. So we hope that we'll be able to get flu vaccine rates up, and we also hope that we can get COVID vaccination rates up. And ideally, we want people to be co-vaccinated against both COVID and the flu.
Doctor, thanks. And that was going to be my next question. Yeah, that was going to be my next question, was the co-vaccination. Now, with this new vaccination for COVID, is that fine to take with a flu shot at the same time? Could it be administered at the same time again, like last year?
Yeah, for the vast majority of people, and I always I'm cautious about giving individual level advice, but for the vast majority of people, they can be co-administered.
Thanks, Doctor, and thanks, Chair.
You're welcome.
Thank you, Gary. Who else? Somebody's got their hand up.
Judy.
Okay, Judy, sorry.
Hi, thanks, Gary. Through the chair, Dr. Nestor, can you explain a little bit more the rationale behind waiting 3 to 6 months for this next round of COVID shots? It's a long time frame, and I'm not really sure people understand, should they be going for 3 months or who should be waiting till 6 months? Thank you.
From a population health perspective, 6 months is the preferred number. Some people want it earlier, but I would recommend wait 6 months from your last injection.
Thank you.
With that, Dr. Nestor, it's Gary. The 6 months, do you feel that there's a fair amount of antibodies that still carry, up to a 6 month period?
Yeah, I think from a technical point of view, you get protection both. There's a broad variety of protections, including cellular and antibody type protections. I think 6 months is sufficient. Is probably the optimal time. That would be my take on it. And I would wait for the 6 months. I think from a public health point of view, what we want is the overall benefit for the community to be better. And so that's why I would recommend the 6 month time frame. Vaccination is one component of trying to help the community overall. On an individual level, there are all these other things that people can do to minimize their risk as well. In addition to vaccination, wearing a mask, also being judicious about the activities you want to engage in. Some activities are higher risk than others. If you go to a dining event, you're more likely to contract COVID. And so when one goes to an event or participates in activity, they have to weigh the risks versus the benefits from themselves as well. Mr. McNamara, I'm sorry for rambling on about this, but no. Bottom line is 6 months is what I would recommend for the vast majority of people.
Even though if your last booster was not the new covariant, the one that's being now presented, still the 6 month would suffice.
I think so. I think one of the things to think about is that you don't have to have a perfect match to get benefit. So yes, I think even if that wouldn't weigh on my mind that to go earlier because you may have not got the bivalent previously, I think I'd still wait the 6 months.
Okay, thank you. Any further questions or comments to our medical officer, Hill? Okay, don't see any further hands up. Thank you, Dr. Nazateri, for giving us the update, and in particular, now with the caseload going up, and so I just want to touch base a little bit on my other hat as the warden of the county and as declared a local state of emergency on our EMS. I mean, obviously, the whole system has to be co-joined, and for the benefit of board members we've had a dramatic increase of code blacks in the month of October. Actually, it was a little over 300% increase to date over September. And we have just under 500 code blacks in the first portion of 3 weeks, or not quite 3 weeks yet, in October. The scary part was on a week ago Wednesday, on October the 12th, I believe is the date, there was not an ambulance available from Woodstock to the Detroit River. Every jurisdiction was in the same, they couldn't spare any ambulances whatsoever. So I think the advice that you're giving is timely. We have to find ways to reduce the impact on our emergency rooms when both hospitals here in Windsor are running at 106, 107% capacity, and Erie Shore is as high as 130%. And so it makes it very, very difficult in dealing with that particular issue. So anything and everything, and I know the media is on the line, and I think get the message out there to self-protect is critical at this stage as we move deeper into the colder weather. And so your comments this afternoon are very timely in terms of don't forego the mask, don't forego washing your hands, and obviously if you're in large groups and that, be cautious of your surroundings. So I think those are very, very important messages to be given to certainly our citizens in the region.
Well, Mr. McNamara, if I could just supplement my comments, if I could have one more minute of the board's time.
Yeah, go ahead.
So I'm a rehabilitation physician as well. The lack of ambulance access is can have catastrophic consequences. If one of us had a stroke right now, Many strokes can be reversed. There are medicines to reverse the actual underlying stroke, but you have to get to the hospital in a timely manner, get investigated in a timely manner, and get the treatment in a timely manner. So not having an ambulance to pick you up is as good as not having the treatment at all, or it diminishes the benefit of the treatment. And when I hear, as a doctor who has both a clinical practice, when I hear that the ambulance can't pick you up, that's a real deprivation to the patients and the community. And stroke is a devastating illness, or can be a devastating illness or disability. And we have something that we can do to help people. And so to me, this issue with the ambulance and availability of the ambulance is a really important public health priority. And I ask all of you to speak on it publicly on how serious an issue this is. Sorry, Mr. McNamara, for going on about that.
No, quite understandable. And so that's why we're doing everything that we can, to really put all of the stakeholders, all of the agencies, and this is a situation where we really got to start thinking outside the box and finding new ways and means of making sure that transportation is there when required. All right, Robert?
I was wondering if we know what gave rise to the spike in code blacks, particularly this month, so significantly.
The biggest issue, Robert, is offloading. With the capacity is the hospital is at 106, 107%, 130 at the Erie Shores. And that's the biggest piece, is they can't offload patients. Some of the ambulances last week were between 12 and 16 hours at hospital, couldn't discharge their patients. And so this is where I think we have to be in a position to be very creative. Chief Crowder has been working diligently with our control group, as well as all the stakeholders, including public health and others, to help mitigate some of those pressure points. The crazy thing is not happening at midnight. It's not happening, it's happening in the afternoon. And where it seems to be the peak between 4 and 7, 8 o'clock at night, where it's, the impact is at its highest. And so I must say we've had opportunities to have good conversations with the minister yesterday, and so they're well aware of the issue. And it's not just unique to us, Robert, here in Windsor-Essex. This is an issue across the province, and it really is impacting the whole system, because the system is only as good as its weakest link. And so what we're experiencing right now is offloading of patients, which is the biggest one. And I think there has to be also an educational piece to residents as well. And I won't get into the whole host of things, because that's a bit beyond the mandate that our meeting is about today. But rest assured, all of the folks from the hospitals to all the other agencies that feed into the system are at the table on a daily basis to find solutions and how to make the system work better. And because that's what's going to take. And there are some pieces of legislation that have to be changed so that it gives more availability to the paramedics and many others, in order to facilitate how and when and where we can discharge and maintain a fluid system.
Is it just partially that the emergency rooms? If you can't unload, then the emergency rooms have picked up in volume for some unknown reason?
Well, I think in in the discussions that Dr. Nezatiri just brought up is the increase of influenza, COVID. The problem is the beds in the hospital. You can't find, you can't move them out of the ER and admit them to a hospital. So that is that's the problem. There's a backup, and that's where the system gets bogged down. We had 26 ambulances at the park at the hospital last Wednesday.
So in my understanding, it's infectious disease driven, essentially. Influenza and
a whole host of things, but
yeah.
But with the onset of I mean, we're getting into the COVID, COVID as well as the influenza season. We're not even into the dark days of it. That's coming, and so we're trying to what we're trying to do now is get ahead of it.
Yeah, sounds like we need a revisit and uptake in the vaccination campaign on the bivalent. The compliance numbers are not what we want to see.
Go ahead, Dr. Nezatiri.
I think the burden to the system is in part related to infectious disease, but I think it's also the fact that we have people with multi-system disease who are presenting to the emergency department, and perhaps they deferred presentation in the past. I think also that people cannot get access in some ways to specialists and primary care physicians like they have in the past, and so therefore they're going to the emergency department.
Yep.
Also, I think that, and this is a hard thing for us to accept, which is that for every category of disease, or for virtually every category of disease, we can do more to help people. And that means greater cost. But that greater cost means that we have to find the resource envelope for that. I do think, and this is not directly in the public health realm, is that we have to set priorities in health and decide what areas of medicine are most important. I support for that, and maybe forego some ideas or some treatments that perhaps aren't all that beneficial. And those are more complicated items that need to be addressed in the immediate term. But right now, I think it's to get the ambulances back functioning and getting the emergency department functioning in a more robust manner.
Yeah. Thank you.
Okay, any further questions or comments? All right, hearing none, Dr. Nezatiri, it's always a pleasure, and thank you once again for those comments. Okay, approval of minutes, regular board meeting, September the 15th. Motion on those minutes. Judy, thank you. Support. Okay, you'll have to. Gary?
Yes.
Thank you. Opposed to the minutes? The minutes are carried. Thank you. All right, move on 6.0 from the minutes, business arising. Let's look at page 10 of your agenda. Is there anything that you want to bring up? As well, administration, anything arising?
So Gary, if I could speak on item 6.5.
Yep.
So as we talked about at the last board meeting, the bylaws and policies enclosed above are being presented for second reading at today's meeting with final approval next month. A question was brought up at the last board meeting about process, specifically about the board's involvement with the bylaws and these policies. And there was discussion regarding potentially or consideration about a policy governance committee in the future. So again, for the purpose of the current bylaws and policies being presented, we're going to continue on with this current process of the board reviewing these directly. But there will be some consideration in the future, and Dr. Blanchett can speak to it about how we proceed on a going forward basis with the new council, with the new board members.
Thanks, Larry. So as I did listen to the last board meeting, and I think there was a little bit of confusion, I think, from our perspective as to do we want to implement the committee right away or not. As the process is starting to continue with the policies, we would recommend to continue with that right now. With the potential of a change of the board after the election and the following week, we feel that it would be appropriate to bring forward a recommendation on creating a policy type of committee, have that discussion with the board and go forward. So that we just wanted to be able to seek a little clarification and provide some background on what we think would be the best recommendation.
Yeah, I think it makes sense. You know, I mean, we're at the end. If you were to do that now, I mean, you're going to lose half of the committee, and then you're back to the drawing board. So it makes good sense to. But I do believe it makes a lot of sense. I'm on other boards where, you know, you've got audit and governance committees, and you know, you bring a lot of the, you know, the ground up type stuff, you know, and it makes a lot of sense. And then you know, with an audit committee as well, where it makes it far more fluid when it does move up to the board level. Okay, thanks, Lori. And anything else within the business arising items? Okay, move on to the consent agenda. Item 7.11. Well, first, you know, I'll at this stage here, I'll just go down the line and basically ask for the directors. 7.11, the SPA enforcement, I think is important. Looking at page 40, Christy, is there anything you want to highlight in that report?
Yep, thank you, Mr. Chair. The only thing I'd like to note is on the second side, just so that everybody knows that the number of students in the end, so you'll see the note is from October 3rd, was the number of students that were still suspended was 49, but that number of individuals that are still outstanding from a records perspective, the suspension order is over, is less than 15. And many of these students that are still on the list are students who were having a difficult time contacting, et cetera. So we'll continue to work with the school boards, but I'm happy to report that we ended up with less than 15 individuals that would be considered to be non-compliant. So great progress, even since the report was dated.
Christy, I don't know if this is a fair question, but how do we fare in benchmark compared to our neighbor jurisdictions?
I can't give you an up-to-date figure. Public Health Ontario is working on an updated coverage report. It is something that we routinely bring to the board, but certainly once those comparison statistics are up to date, I'll be happy to bring those back in the form of an information report to the board and answer your question. So
it's more out of curiosity because I think you've done a wonderful job. Your group, in particular, the numbers were in the thousands, and now you've got a dozen roughly. That's and here we are, it's in mid-October, so tremendous work on top of everything else that we're dealing with. So
it's important to note this group is really the grades 10 through 12, so we still have a lot of work to do in our community, and we'll continue down that path. But I agree. I think the overriding success here is this group of students have approximately a 96% vaccination coverage rate, and that's something to celebrate.
Yeah, absolutely. Thank you. Dr. Nassatiri, I see your hand up.
Yeah, so I was going to just echo that. This is something that the Board of Health and the Public Health Service can be proud of. I think the strategic decision was to focus the verification process on young people entering adulthood. We can be confident, or reasonably confident, that we have launched people who are currently in high school into adulthood being up to date on their vaccines, and that benefit will last them well into their young adulthood and throughout their lifetime. I think that the opportunity for the board, and so we should celebrate that. I think that's the success of this statute and of the efforts of the staff and of the Board of Health. The next goal, if we want to improve the community, is to work for young people who are in grades maybe 3, 4, 5, 6, and I think that's our vaccination coverage rate for that group is poor, or has great opportunities. I think that we're at 50% or around 50%. For HPV vaccine, I think we're at if this is my, and Christy will correct me, but I think for meningitis, I think we're at 1% or some we have real opportunities in this upcoming year to get younger children up to date on their vaccines. And this is one of the casualties of COVID, because we had stopped this activity in the past. And I think we have to, as we normalize our public health focus, to re-establish that as part of our normal public health measures.
Excellent. Okay, if there's no further questions to Christy, or at this stage, if I motion received the report. Thank you. I see Judy. Do I support? Aldo, thank you. Oppose? Carries. Move to 7.12, nutritious food basket. Eric, that's located on page 42 of the agenda. If there's something you want to highlight in that report, but I think there's been a lot of news articles and on food and the food basket and the inflationary costs, and it's really hitting a lot of our the poverty level very hard.
Yeah, absolutely, Mr. Chair, and good evening to you and members of the Board of Health. The report in your package is reflective of an annual mandate, and just so by the provincial government for local public health agencies to calculate the cost of a nutritious basket of food in their jurisdiction. This is something that is completed by our nutrition team within the Chronic Disease and Injury Prevention Department, like I said, on an annual basis. This year, the 2022 cost of healthy eating for a family of 4 in our area is $241.66 per week. When you look at different income scenarios that are outlined in our report, which are reflective of those on social assistance, our most vulnerable populations, you'll see the impact that once you calculate monthly rent, that cost of healthy eating has on their weekly income. And so that's something that we are focused on from an equity standpoint. And so some of the activities that stem out of that are, sharing these reports. And this report is now posted publicly on our website. It's called The Real Cost of Eating Well in Windsor-Essex, updated on an annual basis, like I said. And there's some actionable strategies on the website, as well as additional information on the report for the public to review.
All right, thanks, Eric, for that. Any questions? Hearing none, then a motion to receive the nutritious food basket report. Judy and Aldo, thank you. Opposed? Motion carries. Thank you. All right, we'll move on to 7.13, Q through renewal priority reporting. Christy, is there anything there that you want to certainly highlight?
If it's okay, I'll defer. It's actually on the agenda twice. It's also on under 9.4 with a short presentation from Mark Fry, who's with us, but we can wait till that agenda item.
All right, thank you for that. And finally, Eric, you can wrap up the consent agenda piece, 7.14 communications report. Anything there you want to highlight?
Nothing in particular to highlight.
Okay, and then a motion to receive 7.14 communications report. Thank you, Reno, and supported by Tracy. Thank you. Oppose? That's carried. Thank you. All right, there's no correspondence to deal with members of the board, so we'll go right into 8.0, 8.1, which is the CU transition, and that's on page 47. So, Dan? Anything?
So obviously happy to report that Dr. Ken Blanchette is here live today. I think originally when we started the process, we had a date of November the 28th, and when we put this on the agenda, we weren't expecting Ken so soon, and we've been super fortunate that he was able to start with us on Monday. So Ken, the transition has already begun. The transition is well underway, and Ken has been getting up to speed this week and obviously getting acclimatized to, as what he calls his new home, which was like home to him from before. So transition's going well at this point. There is a resolution in the package that we did pass at the last in camera meeting. And as far as I think the point of originally when this was on the agenda was that we were going to talk about the timeline, but happy to report that Ken is here live today, and so that he is now started.
All right, so it's just an opportunity to acclimatize a little bit. I know as you know, with the board, I mean, obviously we'll have an opportunity shortly. I know that I want to have an opportunity to sit down with you, Dr. Blanchette, and you know, to bring you you know, up to speed or perspective on certainly from the board's perspective, and so I'm looking forward to dealing with that. And I know it couldn't be at the last meeting, but I certainly want to be remiss not to thank the organizing and certainly the hiring committee, Reno, our vice chair, and Tracy and Robert and certainly Dan for keeping us all in order, and because it was it was done very quickly, but very well done. And now it's we've got two of the major issues behind, or one of the major issue behind us. Now we've got two more to do, is to finalize the transfer to the university, our move there, and then locating our future MOH. I think this is you know, big issues that we still have to fulfill. But good to have the CEO in place to help also now manage those transitions with the help of our senior managers moving forward. So thank you, Dan, for everything. And I know you had to give up some weekends and after hours, but thank you for going above and beyond and helping the board achieve its goal by hiring a new chief executive officer.
Thanks.
Okay, any questions or comments, folks? None there. So we'll move on to 8.2, the Healthy Smiles Ontario program and translation support. And Eric, that's your report,
Thank you,
or
Mr. Chair.
resolution, I should say, for support.
Yeah, thank you, Mr. Chair. Healthy Smiles Ontario is one of two provincially funded dental programs that are primarily operated out of the Health Units Dental Clinic. The Healthy Smiles Ontario program can also be utilized by community dental care providers as well. In speaking with some of our providers and knowing about some of the equity-based barriers for some of our most vulnerable populations, one thing that comes up repeatedly is a lack of translation services that can be accessed by our community dental care providers. We utilize this service on a daily, regular basis within our internal clinic, and this is something that we feel that the provincial government could add to the Healthy Smiles Ontario fee guide so that there's a billing code available for translation services in a virtual manner. So the resolution in front of you is that the Windsor-Essex County Board of Health recommends the province of Ontario include billing options for translation and interpretation services in that HSO feed guide, and further that there is a variety of modalities of interpretation, given that it's remote interpretation services accessible 24/7, that should be considered as a useful and affordable option. And further that this resolution is shared with our partners at different levels of government.
Excellent, thank you. Any questions or comments on the resolution? Hearing none, can I have a motion to adopt the resolution in support? Judy and Reno, thank you. Any opposed to it? Hearing none, That is carried. Thank you, Eric. All right, move on to the risk registry update and presentation. Christy.
Thank you. So as a part of the Board of Health's requirements under the Ontario Public Health Standards, we are required to ensure that we have a risk registry framework in place on an annual basis. And so as a part of your board package with the resolution for approval on page 51, you'll find information about this year's risk registry. Mark Fry, who's our manager of planning and strategic initiatives, has joined us, and he's going to walk the board quickly just through the overview, in particular with a focus on the highest risk levels for our organization. So the board has that awareness. And then certainly from an approval perspective, we'd be looking to move this through for our annual, to meet our annual requirements. So Mark, if you want to pop on and share your screen.
Thanks, Christy. I'm going to make sure I share my screen this time, so get it right. Okay.
We can see it.
Can everyone see it? Good.
Yes, we can.
That is great news. Thank you. So as Christy mentioned, I'm going to walk us through our highest residual risks. You'll notice that the risk registry is comprised of 26 risks currently, and it's broken into 12 categories. And it includes information about the nature of the risk, the potential impacts of those risks, and our mitigation approaches. But the ministry asks us to report in Q3 of every year on our highest residual risks. So those are the risks that are still a high likelihood and impact despite our mitigation efforts. And so currently we have 7 of those, and I'm just going to walk through them. And I will couch this as many of our risks and many of our situations are impacted by COVID still. And I think those of you who were on this presentation the last time may recall that was still a topic of discussion, is how COVID-19 has affected our operations. So you'll catch a theme throughout that is still an impact. So the first here is in regards to staff engagement. As a function of the pandemic and just generally our move back to normal operations, we've identified a risk of staff disengagement in work functions. And obviously that could impact employee morale, productivity, and the products and services that we provide to our community. We're at a risk of work disruption, either through labor action and/or the impact of external forces like COVID-19. So a resurgence of the pandemic could impact our staffing complement or our ability to provide the services that we're trying to bring back up online right now. And so that's something we've identified as another potential high residual risk. Probably particularly salient given some of the positions, but we're at risk of maintaining and attracting the appropriate staffing complement for succession planning. And that staffing complement is integral to our ability to meet the Ontario Public Health Standards. So that is something we're aware of as a high residual risk. Regarding information, the pandemic has affected some of the ability to access information as well. Some of the information about our community or local data is pre-pandemic. So the impacts of the pandemic on population health components is still something we'll be sifting through and discovering over time. And so there is a risk that inadequate information could affect our evidence-based decisions and our planning processes. And the consequence of that could be programs and services that don't align with the community needs. We're at risk of system outages. Another commonly cited thing, not just locally, but in the world of late, is attempts to access secure systems in organizations. And so this is something we're aware of and we're taking action towards, but it is still a high residual risk. And one of the consequences could be a lack of or a loss of productivity or business continuity, amongst other potential outcomes. This one here is defined as work, but it encompasses the safety, both physical and mental health safety of our staff when working in the community. And so there's a risk of injury or illness to individuals, which would then affect our ability to operate effectively in the community. We're at risk for non-compliance with our privacy requirements as stated in the Ontario Public Health Standards and by the IPC. And this could affect financially, it could affect us through litigation and or other consequences. So it's something we are aware of and is identified as a high residual risk. So that's the list of 7 that we've identified that will be going in the Q3 report to the Ministry of Health. We intend to continue to update and monitor these risks and to act on the implementation strategies that you'll see outlined in the more exhaustive enterprise risk management document. As well, we intend to begin to develop key risk indicators to better monitor quantitatively those risks and to keep on track with our mitigation approaches. So that outlines where we're at and where we intend to go. And I'm happy to answer any questions if anyone has any.
All right, thank you, Mark. Any questions or comments on the presentation? Okay. Explain yourself very well, Mark.
Thank you.
Okay, then a motion then to accept the report as presented. Thank you, Reno. And do I have support? You'll have to raise your hands. Judy, thank you. Oppose? Motion carries. Okay, move on to 9.0, new business. 9.1, the CEO quarterly report, July to September 2022 on page 52. Being that the CEO has been here in 3 days, he's probably got that one all figured out.
So,
No pressure.
Well, all I can say is Eleanor has been able to provide the report in there, so I'm sure the team will help me out if there's any questions.
Okay. Questions? No questions and a motion receive the report. Reno, thank you. Aldo, support? Oppose? Carries. 9.2, the Board of Health meeting locations 2023. Lori?
So this is an FYI to the board members. For next year, we will be in person. The intention is to have board meetings for the entirety of 2023, except for June and October at the University of Windsor campus, Alumni Hall, McPherson Lounge. And then for June and October, we will be at the Civic Center. All of the details associated with logistics, parking, the location of the rooms will be provided to you through Leanne and your monthly invites.
Okay, thank you, Lori. Just a question here, finishing up the term. When I look at the next scheduled meeting, it would be November 17th, and that's when basically we're done on the 14th in terms of we certainly wouldn't have any quorum, and so we can't have a meeting. And I'm gonna turn this over to obviously administration. If there's some actual business that needs to be dealt with, then I would suggest, and again, I beg the indulgence of the board that to have a meeting maybe on November the 10th to finalize any type of business, moving forward, just so that we can stay, moving forward.
I think that's a great suggestion, Mr. Chair. We can work with the board to see about everyone's availability. because we don't know what might be coming in the next few days, especially, you know, as Dr. Nesateri talked about with influenza and such like that. So we will endeavor to do the 10th for everybody. But I do like that idea, because postponing it to afterward, I don't believe we will have the knowledge of who the municipal members would be of the board for quite some time afterward. Is that correct?
Yeah, that's correct. And I think maybe something that we do on the municipal side, you know, so that we can keep things moving as well, is that delegated authority, you know, to especially for to finalize anything that happens in November and December. I think that's something that should be top of mind on if we have that meeting on November the 10th, just so that we are not in a position where we can't act as a board. I think that's an important piece. That's something that maybe reaching out to the ministry to see if we can do it. Municipally, we can. I know that because right now we're in a position where most of the councils are lame duck, and they've delegated authority to the CAO in that regard. So if you can look at that, and then something we can bring back on November the 10th, and maybe Leanne, you can you know, send out a doodle poll or something like that for November the 10th, and dealing with that, because we know that our vice chair will be vacating the seat. Mayor DiCarlo will be vacating the seat as well. There's elections that are happening with some of the members that are board members as we speak, and then we got to go through the striking committees and so forth. And you know, it's you know, we're going to have an orientation pieces, you know, to bring especially new members on board. So I think it comes on us to have a final meeting, and at least as close as we can to the 14th, which would be the 10th. Obviously, 11th is a holiday for some, and so I think that would be proper. So members of the board, hopefully, you know, you can certainly make that date available, and we'll know shortly when Leanne's going to reach out to you in the meantime.
Mr. Chair, if I may, I will endeavor to get that information for our next JBEC meeting from the ministry.
Okay. Okay.
I believe there might be a question from Tracy.
Yeah, go ahead, Tracy.
Thank you. I just wanted to note something that's been brought up before, but there is an IRCA board meeting that evening as well. So just taking that into consideration when we're scheduling the November 10th meeting, please.
Okay, that maybe if we can maybe look at maybe a 3:30 start, and a good point, and maybe obviously I think the meeting would be light enough. I don't think there'll be a lot, but I think it's just business that would need to be done, I think, accordingly. I mean, and JBEC will meet prior to that, and then we can certainly have a look at the agenda that'll be presented, you know, to the full board. But thank you for bringing that up, Tracy. Okay. I don't think that's more for directions, I think, on that one. But the meeting locations and that, if we can have a motion to adopt the recommendation that Lori brought forward. Thank you, Judy, and supported by Tracy. Thank you. Opposed? Motion carries. Thank you. It'll be nice when we're in person, when we can see some hands moving, some movement. Okay. Just talked about that, Board of Health, Education, and Engagement. Lori, or
I can start.
Sure.
So just from our planning and strategic initiatives department is responsible for the board orientation. So that process is underway for them to look at that, recognizing with the change with the municipal elections upcoming. So more information will follow, but of course, Dr. Blanchette, if he wants to add anything.
Sure, thank you, Laurie. So we talked about, just this week, the focus of the education will definitely be more on an onboarding piece as the transition occurs. And we're going to work together at the leadership team as to try to focus on the key elements that the board are going to require into making the decisions right off the bat, and then enhancing that education piece as we go throughout the year.
Yeah, it's important. I think we've really missed that opportunity with COVID and now return back to that. And I think that's an important piece, because there are since then there have been board members that have not experienced that opportunity that we had, and so I think that it'll be glad. I'll be very happy to see that reinstituted. And it's always good and a great reminder to us of all of the good things that the health unit actually delivers in our community. So good. Thank you for that. Q3 renewal priority reporting presentation, and that's the one I think you alluded to, I think, Christy, but I think Mark's going to do a presentation on that.
Yeah, so on page 44 of your board package is an information report that contains Q3 renewal plan update. So as the board will recall, we presented a renewal plan here in May of 2022 with a commitment to circle back and let the board know how we're doing. And these are plans that are implemented basically to bring us through to the end of 2022, recognizing we're doing a very fulsome public health planning process now in preparation for 2023 and beyond. So Mark's got just a few slides just to bring the board awareness to some of those objectives and activities that we had flagged for you as priority for this year. We can see your screen.
Yeah, can we see it?
Yes.
Nice. 2 for 2. Yes. Thank you, Christy. So yeah, I'm going to walk through just where we're at and give a couple highlights. Maybe highlights is the wrong word. Some examples of the work that we're doing, because a lot of it's all highlights. But just to refresh your memories, as Christy had mentioned in May, we had identified a need to put in place a short-term plan to direct operations in a focus on renewal from the impact of COVID-19. And it did, I'm sure everyone on the board is well aware, COVID-19 obviously dramatically impacted our capacity to provide our typical programs and services to the community. And so we were attempting to shift that and setting out a plan to do that while still maintaining our COVID-19 emergency response actions. And so there were 5 key areas that we identified. You'll notice there's 6 listed here because the 6th is our COVID-19 response, which still does take up a large amount of our FTE allotments as well as resources. But these were broken into health assessment and surveillance, addressing that backlog of services that came as a byproduct of the pandemic, really focusing on mental health and substance use with some of our health promotion activities, as well as healthy growth and development aspects. And then building capacity, recognizing that we have a lot of new staff, a lot of staff who came in and started in COVID-19 and are now going back to where they had originally been hired. And so just building up to be able to do the work that we had intended to do in the past. And so this gives a snapshot, a really high level overview of where we're at as of October 1st. So this represents our progress up until Q3. And we'll bring this back in Q4 too to kind of wrap up this short-term plan and then bring forward our annual service plan for 2023 at a separate date. But currently, 46% of the plans, as of October 1st, 46% of the plans were in progress, 39% were complete, and 15 were not in progress yet, but some of those were actually set to begin in Q4 as well. So it maps on nicely. I won't go into depth in these, but just to give you a flavor for what kind of work is happening under those priorities. So in our health assessment and surveillance priority, we have this focus on our IPAC hub and working with congregate living settings to try and prevent more infectious disease outbreaks, and also to facilitate our ability to stem COVID-19 transmission. As well, you've seen this already. The dashboards for local surveillance data are constantly being updated and new ones are forthcoming. In our addressing of backlog services, we have lots of work going towards screening our children in schools, as well as the Healthy Smiles Ontario program in general. And I think we've already talked about today the great work that the health unit's done in the ISPA area and getting our students immunized. As well, we've been working with individuals in the community related to sexually transmitted infections and trying to get back to where we'd like to be with our supports for that in the community. Regarding mental health and substance use, there's been toolkits developed related to mental health for our local school boards, as well as a suicide prevention community action plan that's in develop. And we've done vaping and opioid and cannabis toolkits, both for the public, but also for the school boards. In terms of healthy growth and development, we've put a lot of time into direct care with our new families and new moms. As well, we're partnering more with our hospital entities to try and make sure we're there to support like we were before COVID-19. And we've implemented a newer program called Legacy for Children, which really focuses on parenting skills for new moms that are our priority population groups. In terms of capacity building, a lot of work, as I kind of alluded to before, has gone into reorienting staff who have been seconded to the COVID-19 efforts, or who, as I mentioned, have not even been in their originally assigned departments, and now getting them up to speed. This has included calibration training for our dental hygienists who go in and screen all the students to make sure that their screening is reliable and effective. As well, we've put work into updating our medical directives to ensure that they're up to date and reflect the best practices in public health. And then I'm sure you're well aware of all the work we've still been doing related to COVID-19. And that includes inspecting refrigerators to ensure the safety of the cold chain for getting those vaccines to the right places, as well as providing COVID-19 clinics where we vaccinate individuals, and working with our healthcare providers and our pharmacies to ensure that we're administering vaccines and stemming the tide with COVID-19. And in terms of next steps, we will continue to report in Q4 and provide our updated progress, and hopefully everything is completed and successful by that point. And that's it. Again, I would be happy to answer questions if anyone has any questions.
All right, thank you very much, Mark. Questions, comments? All right.
Thank you.
Comments? Thank you, Mark. Then I'm looking for a motion then to receive the report as presented. Thank you, Reno, and Aldo support. Opposed? Motion carries. Okay, so November, December, well, I think we talked about that in terms of meeting, but I think November, Dr. Blanchet, you'll come back to us very shortly on that, but I think we need to have a kind of a wrap up. Any unfinished business that needs, especially getting close to year end, I think it'd be important to have that. And I think that would be it to a degree. Any we need to go into committee of the whole minutes. Tracy moves, and I need support. Judy, thank you. Okay, all in favor. So we're going to move into committee of the whole.